Hello and welcome to episode 2 of Canopy TV. In this latest episode, we explore the impact cancer can have on men's health, sexuality and their relationships. And we also talk to caregivers and supporters about the role that they take on, the challenges they face and the care that they need as caregivers for those people with cancer. Cancer treatments can cause changes in sexual desire and function. And in this next video, we talked to patient Malcolm Norton and his wife Layla about their journey. We also talked to medical oncologist Dr. Fritha Hanning about some of the issues that her patients might face, and CEO of Prostate Cancer Foundation Graham Woodside about the support his organisation provides men.
When men are diagnosed with prostate cancer, they quite quickly become aware of the issues that they may face in terms of the negative side effects that come out of their treatment. And so erectile dysfunction and incontinence just tend to come with that territory. Prostate cancer is effectively a couple's disease, and while the man has it, it still does affect the partner and those people around them. A man's maleness, if you like, is really linked to their sexuality. And for many guys, they are concerned that they won't be the same again, and that's the reality of it. At least for the short term, or the short to medium term while they're having their treatment, they may not be able to be sexually active, and they may have to deal with incontinence. But for some guys, well, they say, at least I'm alive, I can live with those other things.
In terms of sexuality changes with hormone therapy, one of the things that happens when you start a hormone therapy for prostate cancer is that it does lower the male hormone testosterone. And that testosterone is an important part of our libido, of how we feel in terms of that desire to have sex, and so that can change. And for some people that's really key, and for others it's not as important. And so it's about thinking about how important is that for you personally and in your relationship. There can be these changes in sexual function and changes in intimacy, and I think that's just working together as a couple to decide what's important.
So the physical thing was never quite the same, but for me, the cancer has definitely affected my ability to the erectile dysfunction aspect. So from a personal point of view, yes, it's looking back, it'd be really nice to be able to still be able to do that. However, life goes on, and I think I'm a fairly pragmatic sort of guy, and I'm just so thankful that I don't have the other major issues. Now the cancer's under control and I don't have any incontinence issues. It's not good for a guy not being able to deal with having to deal with erectile dysfunction, and it's probably easier the age that I am. I'm sure that for somebody who's much younger, it would be really, really difficult.
For me, to deal with the lack of the physical side of your relationship, I basically just put that part of my life in a box and just nail the lid shut. The thing that's really important is that you're still here and that we can still start our journey together, and not everyone gets that opportunity.
In some respects, we're probably closer now than we were prior. That's from my perspective.
Some of the hormone treatments that are used to treat prostate cancer, they can cause side effects. So people can have the impact of hot flushes. Sometimes they can find that they maybe have a tendency to gain weight. So it's, in a way, having hormone therapy for prostate cancer is a little bit like a male menopause. And quite often wives are saying, well, I know exactly what you're going through because I've been there too. And that change in your hormones, often as you go through the change when you're first starting the treatment, the symptoms and side effects can be worse than they're going to be once you get through that change.
There's a lot of frustrations. I mean, one of my frustrations is with some of the side effects from the hormone treatment, and that sometimes you're just not quite as resilient, and sometimes the hot flashes and things are probably the worst. But however, you just have to learn to deal with that because that's the new normal.
The Prostate Cancer Foundation is there to support men and their partners and their families going through prostate cancer diagnosis and treatment, both of which can be pretty challenging. And we're really about four things. The first one is awareness, and so we do quite a lot out there in the community, making guys aware of prostate cancer and getting checked. We provide support to patients and their carers. We fund some research. And we also do quite a bit now in advocacy, trying to get better treatments, better diagnosis, better medications, and intervening when patients have problems getting their treatment.
Caring for a loved one with cancer is an important job. It's a fundamental role, but it also has its challenges. In this next video, Mark Stanton shares his personal journey about supporting his sister Trish through her cancer. And we also talk to Kelly Banks about the challenges she faced as a caregiver and the ways in which her organisation's support crew can help ease the burden.
Being a caregiver for someone going through a cancer journey is really difficult because it's something that you get thrown into immediately, and it's something often that you're not prepared for, but also you're going through a time that's very overwhelming and stressful and quite traumatic. And I think what really changes when you're a caregiver is that your relationship with that person changes. So like you say, you were the partner of a person, and now you're kind of their caregiver, and that has its ebbs and flows.
Any cancer diagnosis, it doesn't just affect the person who has been diagnosed with the cancer, it actually affects everybody in their family and community, and a lot of times people don't realise that, and the partner is the key. And partners sometimes say to me, you're the first person who's asked me how I am, which is really quite amazing. But I guess naturally people focus on the person with cancer, and that's a totally understandable thing to do. But just to remember that the partner is also someone going through their own issue, and that they need support too.
Probably the biggest stress was watching her once she started her chemo, because Trish has always been a bit of a lioness type figure to myself and my brother in the early years. So to watch someone so strong, all of a sudden go through chemo, watch the physical changes with her, that was difficult, and watching her slowly, weaken. A lot of things go through your head, and I guess the obvious one is the potential risk that she wasn't going to be there. So trying to work your own way through that really as brothers.
I think the hardest thing is just the fact that because I was working full time, you have to leave somebody at home that doesn't feel well. And you feel, I don't know whether it's guilt, but you would just like to be there sometimes and be in a position to be more supportive. So to be supportive, you have to then turn that into practical things like making sure that the smoothie's done for lunch, or that the breakfast cereal's made and organised. And it's just doing the little things in life to make sure that that person's day can be as pleasant and as problematic free as possible.
For some caregivers, asking for help can be hard, and unfortunately, not everybody is tuned in to supporting you as a caregiver supporting somebody with cancer. It is really important that you get the support that you need so that you can care for the person that is having the treatment.
For me, I didn't actually know what help to ask for because I didn't really know what help I needed, and I guess the result of not recognising that and being able to ask for it, that impacted on my own relationship, so in terms of communication. So what I would say is that you can't get through it alone no matter how strong you are.
The things that I struggled with the most certainly was asking for help. So we had so many people saying to us, let us know what I can do to help. And it was really difficult to know what help I needed because I was in that real place of overwhelm and stress and kind of dealing with, getting our head around Randall's diagnosis. We struggle to ask for help because we're absolutely afraid that somehow we'll seem like a failure because we haven't been able to do it all ourselves, which is quite ridiculous when you think about it. By not asking for help, we leave our friends and family not knowing how to help and not being able to connect with us in our journey in the way that they want to.
There were a lot of people that wanted to help, and look, I would say take on that help.
You do need, as a caregiver, to acknowledge that you need time for yourself and that you actually do need to look after yourself and your health in order to be, the best caregiver that you can.
Exercising is a good thing, trying to keep your daily routine as best you can, not changing your own life dramatically, keep in touch with your friends. I think just being gentle on yourself, which is difficult to do at times, but I think you need to recognise that you do need your own space, and going for a run, walk, meet someone for a coffee, and finding that person that you can just talk to that's not going to be judgmental or offer any advice. Just be there for you. So just the simple things really.
Support Crew is a free online support platform. So essentially it helps coordinate meals, transport, accommodation, could be cleaning or companionship or any other help that's needed from friends and family. So in its essence, it's like an online help roster, I suppose. And we've set up Support Crew just to make it easy for people to know what help they need and how to ask for help, and also to make it easy for their friends and family to know exactly how to help.